Hello, everyone, and welcome back to Occupational Therapy for Professional Drivers, or OT for PD. My name is Jade Matthews Rosado, and here at OT for PD, we talk about MSD prevention for professional drivers with the basis in occupational therapy, hence the name. We have a lot to cover today, so stick with me, and you'll get a lot of information by the end of it. Let's go ahead and get started. Now, by the end of all of this, the goal is for you to have solid understanding of the basics and resources that will help you fight against MSDs autonomously. I'm really excited about sharing this information with you, and I hope that you find it fun and informative. If you like what you see, this is a quick reminder to go ahead and subscribe to this channel, and don't forget about those notifications. Today, we're going to talk about the personal risk factors that contribute to MSDs. But before that, I think we need to do a quick recap. By now, you already know that OTs are problem solvers, and they focus on meaningful occupations or the things that we need to do or that we want to do. You also know that barriers are problems that keep you from fully engaging in those meaningful occupations. Now, for professional drivers, the meaningful occupation that we're going to address here is driving for work. And one of the biggest barriers to driving for work are MSDs, or musculoskeletal disorders. Now, MSDs are injuries that affect the body's movement systems and structures like the muscles or the tendons and nerves. Professional drivers are specifically at risk for MSDs because of the very nature of their jobs, which often causes trouble with work participation. Now, last time we mentioned three broad categories of risk factors that lead to MSDs: personal, environmental, and institutional or organizational. Today, we're going to focus on those personal risk factors. We see that under personal contributors, we have repetitive motion, which is just doing a motion over and over again, bad or awkward posturing, prolonged sitting, poor habits and lifestyle, and poor rest and recovery. Now, remember, all of these things contribute to the slow breakdown and injury of the body, and they can create pain and discomfort that can increase on a daily basis. And all of these can interfere with job performance, work sustainability, and safety. But for the sake of time, we're going to talk about a couple of basic things that you can do today to fight against these personal factors. Now, here's a disclaimer. As I mentioned before, I am a doctoral student, which means I can't officially treat you right now. But my goal is to provide you with basic information and resources to help you fight MSDs autonomously. All right, let's talk about posture. What does good or bad posture look like to you? The reason I ask is because I feel that we all have a pretty basic understanding of what good posture is, but we may not understand why it's considered good posture, if that makes sense. In the same way, I feel like we have a pretty basic understanding of what bad posture is, but we may not know why it's considered bad posture. So let me go ahead and define posture for you. According to the Cleveland Clinic, good posture involves training your body to stand, walk, sit, and even lie down in positions where you have the least amount of strain on your muscles and ligaments during activities. Now, one of the ways to avoid the strain on your muscles and ligaments is to maintain good alignment. And one of the best ways to determine your alignment is to look at the spine. Now, let's look at some examples here. These are all standing examples, but the same principles apply to the sitting posture as well, especially while you're driving. Now, you see different colors out here, but the ones in blue are the ones that represent the ideal posture. Now, it's really important to know that from the side, the spine is supposed to have three natural curves, one in the neck, one in the upper back, and also at the lower back. The spine is meant to be flexible, but it's also supposed to return to its natural position of alignment. When the spine is aligned, everything attached to the spine will be exactly where it needs to be, and they will be properly supported by the muscles and the ligaments that are attached to these structures. Now, if this is good posture, you can understand that the opposite would be true of bad posture. Poor posture causes the spine and everything attached to the spine to go out of proper alignment, which forces the muscles to strain and stretch and even shrink to accommodate the position that the body is in. And because the body is forced to compensate for the bad posturing, the muscles and the other structures can't work as effectively, and they start to fatigue and even cause pain. Now, some common things you might see in poor posture are rounded shoulders, the forward head or the chin sticking out way in front of your chest, uneven shoulders or hips, and overly flat or overly curved lower back. These are what I like to call red flags because, again, they happen while you're out of alignment. Um, you might remember in middle school when all students were tested for scoliosis, which is a condition of the spine that causes sideways curves. That curve causes the body to be out of proper alignment, and it needs to be corrected early on so it won't cause other issues. In the same way, poor posture should be addressed early on so that it won't cause worse problems later on. Let's do an experiment. Go ahead and sit on the very edge of your chair and sit in the best posture that you can do. And what I want you to do is hold that position for 2 minutes, 2 whole minutes. Simple enough, right? I'm going to set a timer so you can keep track. And then when we're done, we'll come back and see how you feel. Are you ready? Let's go. Now, everyone, just relax. How did that feel? We only held that position for 2 minutes, only 2 minutes. But maybe some of us are feeling a little bit tired. But why is that? We're activating all the proper muscles that support good posture. And because we don't use those muscles very often, because we don't sit in good posture, now that we engage them, we become a lot more tired very quickly. But how do we make those muscles become more accustomed to good posture? I propose two things: consistency and conditioning. Now, consistency involves remembering to practice good posture every single day. And some ways that we can do this are setting phone reminders or even watch notifications. Or you can get accountability from fellow drivers. You can also do visual reminders, especially if you need to see something to remember it. You can put up pictures or some sort of visual in your vehicle to help you remember. Now, being consistent is also important in our next part, which is conditioning or training to increase tolerance. By conditioning the affected muscles, you train them to tolerate proper posture for much longer than 2 minutes. A great way to help with this is by strengthening. And there are three pretty simple exercises that you can do today to help build those back, shoulder, and neck muscles. And here they are. You can do shoulder rolls, pretty self explanatory, rolling forward and rolling backward. Well, 30 times each direction, and you'll start to feel them, I promise you. You can do shoulder rows, or what I like to call back squeezes, where you're pulling those shoulder blades back and tucking them down as if you're tucking them into your back pocket. So you're pulling back and tucking down, and you're going to do those about 30 times as well. And then the last one, pretty simple, is shoulder shrugs. Self explanatory again. Bringing your shoulders up to the ears, bringing them back down, and letting them relax. Up and then down. If you do each of those exercises about 30 times, like I said, you'll start to feel it, but you'll also build those muscles needed to maintain pretty good posture or to build those what we call proximal muscles to help support good posture. Now, for your reference, I'll go ahead and put some of these exercises down below in the description so that you can go and look at them and practice them on your own time. Here we go. I mentioned before that there are two things that you can do today to help you prevent MSDs. The first thing dealt with fixing your posture, and now the second thing pertains to your rest and recovery. If you're a driver, you might be on the move for most of the day, and during breaks you might also have a lot of things to do. So R&R might be the very last thing on your mind. But believe it or not, rest and recovery is just as important in preventing MSDs as is good posture. For example, imagine that you're at the gym working out and you have to complete 2 sets of 20 squats. Now, if you're like me, after the first set, your legs will probably be burning, you might be breathing heavily, and you might even be sweating because that was a lot of work. I can guarantee you that even if you wanted to, even if you wanted to continue those sets and start up again, you would take a break because your body would be desperately telling you that it needs time to rest and recover before starting up again. Now, this same idea of rest and recovery should be purposefully incorporated into your workday. In other words, you should be intentional about making time for rest and recovery even while you're driving. Now, some believe that you need a lot of time to fully rest and recover, but that may not be the case. You may not need as much time as you think to really rest and recover. Now, micro breaks or small frequent breaks can be just as effective and powerful as longer breaks. As a matter of fact, according to a 2015 study, a 1-minute break could be just as effective as taking a longer break of 5 to 10 minutes. So, what is the actual purpose of taking a micro break? And what does that mean for you? Now, micro breaks are interruptions of the workday occurring at regular intervals, and taking these breaks helps you to feel less fatigued and more energized and even more attentive. Micro breaks can also help you recover from daily stressors, and it's also said that they can have a profound effect on your overall well-being while improving your focus and attention for better driving performance. So, what can you do during a micro break? Two great things that you can do during micro breaks are stretching and getting your mind right. Have you ever been mad or upset while you're driving and your mind is totally and completely occupied with those mad thoughts? You might miss a turn, you might run a red light, you might even hit a mailbox and not even know that you did it because you're so upset and distracted. This is more of a problem than you think because not only does it interfere with your work and your safety, the other safety, but it can also cause issues with the rest of your body. Now, with aggravation comes muscle tension, and with muscle tension comes muscle strain, which can lead to injury and even make MSD conditions worse. This puts you and everyone else you're driving with or around in danger. So it's important during your micro breaks to get your mind right if you need to. We'll talk more about some techniques to help you get your mind right in another video. But for now, let's move on to stretching, which is our next thing that you can do during micro breaks. Now, stretching helps you to loosen up your tight muscles, increase blood flow to your body, and also relieve tension within your body. There are several great stretches that you can do, and I'll include some in the description below. But there's one in particular that will help you loosen up and improve your posture, and it's called the Brugger's Postural Reset. And I want to show you how to do this super quick stretch today.
Hello, what we're going to do today is go over the Brugger postural exercises. So for those people who are in a posture like this throughout most of the day, either at a computer or driving in a car, what we're going to do is give you exercises to combat that type of a lifestyle that you're having to do every single day. So instead of being in this position, we want you in this type of position. Okay? So one thing that we're going to do is make a thumbs up, have it pointed forward, head up, and what you're going to do is you're going to rotate your thumbs back and point behind you. Now, the most important part from behind is when you're doing it, you're squeezing your shoulder blades back and down. Okay, a lot of people when they do it, they bring it up and together. Okay, I don't want that. What you want to do is keep your shoulders down and squeeze the lower part of your shoulder blades together. Okay, then what we want to do is we want to add the neck into it. If your head's going forward, what we want to do is we want it to slide back. Okay, so what we want to do is have you make that nasty double chin. Then you know you're doing it right. So what you're doing is you're taking your head back and you're holding it like this. Don't want your head up, don't want your head down. Have it go straight back. Okay? Then what you're going to do is you're going to hold it for 15 seconds. Maintaining your breathing. Then what I want you to do is to combine the two together. So rotate your shoulders back and down with your head slid back and holding it. Remember to breathe. When you want to add your breathing, what you're going to do is so when your arms are back and down, it's going to expand your chest. Okay, so what you're going to do is you're going to take a deep breath in to expand your rib cage. So what you do is you bring it back, bring your head back, nice deep breath, let it out. Okay, so start off small. If you need to break it down into just the arm movement, and then break it down into the neck movement, and then combine it together, that is perfectly fine. But the end goal is to make sure you do this a few times a day, especially if you're in that slouch position.
Now, I really hope you liked that stretch. It's one of my favorites that I've learned recently. And like I mentioned before, I'm going to go ahead and include that in the description below, along with some other stretches and strengthening techniques that you can do or that you can practice in your spare time. Now, I don't know your schedules, but I would suggest that you find whatever time that you can to incorporate micro breaks into your daily schedules. Take a few seconds to practice stretching and the strengthening and even mindfulness. And those things can make a really big difference if you're consistent. Okay, so today we looked at posture and found out that it's more than just sitting up straight. It's about alignment and minimizing the amount of stress and strain on the body. We also looked at micro breaks as a means of helping the body rest and recover throughout the day. Now it's time to test your knowledge. Go ahead and navigate to kahoot.it or just click this link right here to take you to the Kahoot quiz game. You'll see that it asks you for a pin, and you'll find that pin on the screen here, or you will find it down in the description below. Let's see how well you remember the information. That's all for today. If you have any questions about anything we've covered today, or if you have any suggestions on how to make this channel better, go ahead and email me at this email address below, or leave a comment down below. And as always, don't forget to like and subscribe, and don't forget about those notifications. We'll see you again next time.